Good day everyone. The skincare ingredient on review for today is tretinoin. Another name for tretinoin is all-trans retinoic acid or TRA. Dosage forms available are gel and cream. The percentage of active ingredients is 0.1%, 0.08%, and 0.04% for topical ingredients. Tretinoin is a vitamin, a derivative in the retinoid class of medications. Tretinoin is a generic name for a medication derivative of vitamin or retinol, which is also commonly known as all-trans retinoic acid or a TRA. Tretinoin can be given systematically or topically for various indications. Tretinoin or retinoic acid is a prescription retinoid. It's 20 times more potent than OTC retinol and achieves the faster result. The mechanism of action of tretinoin are the following. The exact mechanism by which topical tretinoin functions are not completely understood, but current evidence suggests mediation through the binding of retinoic acid receptor alpha, beta, and gamma along with retinoid X receptors by blocking inflammatory mediators. By doing this, the production of procollagen increases to augment collagen type 1 and type 3 formations. RR-gamma effects are associated with mucocutaneous tissue and bone. Tretinoin's effectiveness as an acne medication is because of its ability to modify abnormal follicular formation that comes from excessive keratinization of epithelial cells. Tretinoin promotes cornified cell detachment and enhances shedding. Tretinoin increases mitotic activity, thereby increasing loosely adherent corneocyte turnover. By doing so, the comedo contents can be expelled, with a reduction of microcomedo precursor lesions of acne vulgaris. Retinoic acid binds to retinoic acid receptor alpha, a member of the steroid thyroid hormone receptor superfamily. RRS form heterodimers with RXR and bind to retinoic acid response elements that are present in genes involved in cell differentiation. Here are the indications, off-label use, and interesting ongoing experiments of tretinoin. This is used topically or systematically in treating mild, moderate, and severe acne. The FDA indications are the following. Topical tretinoin gel and cream FDA approved for use as a topical applications for the treatment of acne vulgaris. It is used as an adjunctive palliative treatment of photoaging, for the management of fine facial wrinkles, for the management of facial skin roughness, and facial mottled hyperpigmentation. Example of this is liver spots. It has an FDA off-label uses such as it is used to manage actinic lentigines like liver spots, sunspots, and age spots. These are small, gray-brown spots that appear on the wrists, backs of the hands, forearms, and face. Actinic lentigines are not a type of skin cancer, do not progress to become skin cancer, and do not require any treatment. It is also used for the management of psoriasis, ichthyosis congenita, ichthyosis vulgaris, lamellar ichthyosis, cutaneous warts, the flat subtype, keratosis follicularis or Darrier disease, epidermolytic hyperkeratosis, keratinopathic ichthyosis, verruca vulgaris, and early stretch marks. These are interesting topics requiring further studies for use of tretinoin. The combination of minoxidil with topical tretinoin may show increased hair growth due to increased penetrating ability. Here are the proper way of applying topical tretinoin. Topical administration of tretinoin includes applying a thin layer once daily, before bedtime, to the skin where the lesions are present. Patients need to keep the medication away from the eyes, mouth, nasal creases, and mucous membranes. The dosages vary among different brands. Read carefully the instruction on how to use the brand that you are using. If you are not sure, ask the assistance of your pharmacist to explain the use in simple terms. A commonly used topical tretinoin consisting of 0.1%, 0.08%, and 0.04% dosages should be applied once daily, during the evening, to the skin where the acne lesions appear to be present, with enough to cover the entire affected surface in a thin layer. According to FDA-labeled drug guidelines, contraindications include patients with evidence of hypersensitivity to tretinoin or any of its components. Here are the topical tretinoin contraindications and precautions. Hypersensitivity to the drug class, or drug formulation components. Caution if hypersensitivity to fish products when using 0.05% gel and lotion of topical tretinoin. Caution if sunburn. Caution if photosensitivity. Caution in eczema. And caution if pregnancy first trimester. This is pregnancy category C in the US, and pregnancy category D in Australia. According to the FDA drug-labeled guidelines, the most common adverse effect of topically administered tretinoin are the following. Pruritus, skin pain, skin and subcutaneous irritation, erythema, and pharyngitis. Symptoms of overdose with topical tretinoin use may include excessive redness, peeling, and discomfort. Symptoms of overdose with oral tretinoin include the following. Cracked and sore lips, redness, headache, flushing, stomach pain, dizziness, and loss of coordination. Sunscreen is a requirement for all patients on tretinoins, as there is an increased risk of photosensitivity. Encourage avoidance of exposure to sunlight or tanning beds. Patients should be encouraged to wear protective clothing and use sunscreen when they are outdoors, even on a cloudy day. Recommended SPF 15 or higher according to the tretinoin drug label. Advise patients to avoid using skin products that may cause skin irritation and dryness, such as harsh soaps, shampoos, hair coloring chemicals, hair removers, or skin products that contain alcohol, spices, astringents, or lime. Here are way on proper storing topical tretinoin. Store it in a cool, dry place and not in direct sunlight. Store it at temperatures not exceeding 30 degrees centigrade. And remember to keep this product away from children. Other recommendations when using tretinoin. Tretinoin in gel, cream, or lotion requires a prescription from your doctor or healthcare professional because it's more powerful than retinol. Do not use tretinoin without understanding the proper usage of this topical product to prevent possible future skin problems. Do not share this topical product with anyone. Health and safety tips when using tretinoin. Monitor for hypersensitivity, photosensitivity, and any other skin irritation or allergies. Caution for patients with blood disorders when using the oral forms of vitamin-related products. Not advisable for pregnant and breastfeeding women. Please consult your doctor if you need to apply this medication. Use SPF 15 or higher when using tretinoin. Follow the instruction on the proper usage of sunscreen in terms of applications. Thank you for listening to this video presentation. Have a great day ahead of you.